We have a 72-year-old gentleman here who has been treated with a 2-drug regimen or lenalidomide and dexamethasone. Certainly based on randomized clinical data from the first trial, this is appropriate management for a patient who is not transplant eligible. However, I think that even in the older patients, one needs to make an assessment whether a patient can be treated with a 3-drug regimen or with a 2-drug regimen. Even patients who are not transplant eligible between the ages of 70 and 80 often can tolerate dose reduced bortezomib, lenalidomide and dexamethasone, and barring any serious comorbidities that prevent one from using the 3 drugs, my own inclination is to treat the patients with a 3-drug regimen. In the case that we have here, we have provided with somewhat limited information about the patient's actual performance status. We certainly don't have any geriatric assessment done here. We are provided with information regarding his past medical history of hypertension and his inability to climb a step of stairs. I think that given the data that we have here, I see actually no contraindication to have treated this patient with a 3-drug regimen. If the patient had had other comorbidities, often patients have diabetes and neuropathy. That is one thing that often in an elderly patient especially may drive me away from the use of bortezomib. However, I think that as far as this patient goes, he did have a good response. With the very good partial response attained, I think that is an acceptable level of response in an elderly population. In younger patients these days, especially those who are transplant eligible, we try to strive for deeper depths of response because deeper depths of response have been correlated with better long-term outcomes in terms of survival. However, in this older population, we do often balance the benefits in terms of depth and durability with tolerability and quality of life. In the elderly, there is data that depth of response does correlate with survival though. But I think medicine is as much art as it is science, and we do want to individualize treatment for our patients.